Scar tissue massage. Prevent adherence. Reduce redness. Increase pliability of scar. Number 1. Zigzag mobility technique. Place both thumb on either. Depress enough to anchor the tissue and mobilize the scar transversely in opposite direction. Pressure variation used according to patient capacity to tolerate. Number 2. Zigzag with friction technique. Place 2 thumbs on either side of the scar. Depress the tissue using desire pressure. Move the thumb transversely across the surface of scar in opposite direction. For larger area, the palm of hand may be used. Variation in pressure may be applied with those technique. Perform with or without lubrication. Number 3. Pinch and roll technique. Pinch the scar between your thumb and fingers. Gently lift and walk the finger forward across the tissue, rowing the scar or skin without releasing it. The thumb work as a support to the lifted tissue. Push the tissue forward as the finger release and grip new tissue. Perform without lubrication. Lubrication may be used, but it will give frictionless area and movement disruption occur. Movement occur gentle and slowly and in stretched position. Skin rolling is used to restore mobility to tissue interface. Number 4. Pinch and zigzag technique. Pinch the scar between your thumb and finger and gently lift. Mobilize the tissue transversely in opposite direction and maintaining the pinch lift. Number 5. Pinch and traction technique. Pinch the scar between your thumb and fingers and gently lift. Then traction the scar by moving the hands away from one another, creating tension in the scar. Perform without lubrication or use lubrication for enhanced comfort of the patient. Number 6. Stretch massage technique. Using one thumb of hand to anchor part of the scar with the other thumb of hand. Apply moderate amount of pressure and mobilize the tissue of the scar under traction. Hold momentarily and continue to slide the hand across the surface of the scar. Using lubrication is preferable for patient. Number 7. Circular and mobility technique. Place palm or finger over the scar area and depress the tissue enough to mobilize the scar in a circular direction. Variations in pressure may be used. For smaller scar, use thumb, and for larger scar, use palm of hand. Perform with or without lubrication. Number 8. Circular friction technique. Place your palm of hand or fingers over scar area and depress using desire pressure. Move your palm in a circular direction slightly over the surface of the scar. Variation may be used in these techniques. Circle size may be small for isolated area or large for greater surface area. Number 9. Torsional massage technique. Apply both hand with a cylindrical grip on limb maintaining grip, and slide hand on opposite direction across the surface of the scar. Rotate the tissue cylindrically back and forward on the extremity. Perform without lubrication. Number 10. Palm effleurage technique. Start and end session using palm effleurage, aiming for increased circulation, reduce swelling, and mobilize fluid. Move with palm of hand across the scar tissue gentle and slowly, and return without pressure and using lubrication for easy movement of hand.